Well, first of all, it's extremely easy. We have probably the best organization in the world to build upon and deal with, so that makes the job a lot easier. I'm a huge fan of our motto that we model excellence. Now, last year and this year in Seattle, we've virtually doubled the opportunities in the program for presentations, speaking positions, etc. What we need to do is build upon that and underscore the fact that we want absolute excellence. In addition to our meeting, there's a couple of things that we've done extremely well, and we need to build on those. One is the Aortic Symposium, which for its purpose is the #1 venue every other year in the world. And in the Mitral Conclave, another outstanding opportunity that the AATS provides. Last year, we expanded our presence in Turkey with an excellent meeting in Istanbul, and we want to build upon this international presence and educational opportunities. We're going to go down to Brazil later this year, and I think we need to build upon that to Asia and elsewhere. There's a couple of areas, not that I've been so intimately and personally involved in, but I think for our specialty are critically important. One of which is general thoracic. You know, the focus meeting is something that we're gonna have to put a lot of attention to, and again, we want it to be the best of the best. In addition, despite the prediction of its demise decades ago, coronary artery bypass surgery and revascularization has not and appears not to be going away. This is another area that we're going to continue to focus on. We think our members need it. It's a bread and butter part of our specialty. It's part of our training programs, and we need to be sure that it's built into all of our educational opportunities. One of the most recent sort of draconian changes in our specialty has been the TAVR, the catheter-based aortic valve replacement, and soon mitral valve replacement, valve in valve. 10 or 15 years ago, who would have predicted? I think something that we all have to keep in mind, and that is that the operations that our mentors did, the people that preceded us, the legends, as it were, when they were at the pinnacle of their practices, they were doing operations that evolved over the course of their experience as cardiothoracic surgeons, not things that they learned when they were in training. As in our situation, many of the operations that we do, endovascular stent grafting of the aorta, I mentioned a valve replacement with catheter-based technologies, etc. And this is in the same sort of things, technology and innovations taking place in the general thoracic arena and in the congenital arena as well. And so I think one of the important things is part of an educational process and as a career development is to have a solid foundation intertwined with intellectual curiosity to evolve your thoughts, evolve your practice, and adopt new technology and innovations as they present themselves. Equally as important, because we want to train the leaders of the leaders, we need to integrate into our own members to be leaders in this intervention, not necessarily just to be followers, but for our specialty across the board to be able to adapt these and accept the ones that provide excellent care for our patients. One of the evolving issues in our specialty is, of course, critical care, and the ability of our members, our surgeons, to not only preoperatively evaluate patients, give them the best possible surgical intervention, but these are our patients to take care of post-operatively. So one of the things that we're going to do in Baltimore is bring back the Critical Care Symposium to help reinforce not only that from an educational experience, but to make the statement that this is part of what we do as cardiothoracic surgeons. There's a new footprint to this meeting over the last couple of years, and we're still in the process of digesting that and making it the best possible thing that it can be. So the experience for the meeting in Baltimore will seem very, very similar. There will be some changes, but it will feel familiar. They're not going to be draconian.